Is it safe to have a baby while on finasteride? For women, finasteride is not permitted during pregnancy, given the risk to a developing fetus. But what about for men who are on finasteride? Should they come off of finasteride for family planning? Here's a common scenario. A guy has been doing great on finasteride. He feels like he's gotten his hair loss finally under control. And then life changes. He and his partner are now thinking about the potential of having kids. So let's walk through this scenario the way that I do for a consultation. And let's incorporate what the literature actually says. But first, let's start with something reassuring. For most healthy men taking finasteride at the standard hair loss dose, which is 1 milligram orally, there is no evidence of meaningful harm to sperm production. One of the most cited studies here is a double-blind controlled study from 1999 in which men took finasteride 1 milligram daily for 48 weeks, and researchers tracked semen parameters. The conclusion was very clear. There was no meaningful effect on spermatogenesis or semen production. That is why so many men take finasteride for years and father children without any problems at all. But then you go online and you see posts like the following: I stopped finasteride and my sperm count went up. Or I was trying for months, then I stopped and things improved. And there is data to support that. There's a paper from a male infertility clinic population from 2013 that looked at men taking finasteride who already had fertility concerns. After stopping finasteride, the average sperm count increased 11.6-fold. And among men with severe oligospermia, 57% improved into a higher range after stopping. And by higher range, that means improving into a less severe sperm count category, such as moving from severely low to moderately low, or in some cases into normal reference range. So the story is actually more nuanced. Most healthy men are fine, but a small subset, often men in a fertility workup, may be more sensitive. And importantly, when finasteride is a factor, the effect appears reversible. And when you look across the studies, of course, medication dosing matters. At the 1 milligram dose used for hair loss, most controlled studies in healthy men do not show meaningful effects on sperm production. At higher doses like 5 milligrams, which suppress DHT more strongly, you start to see a higher likelihood of changes in semen volume and sperm counts in some men. Dutasteride is a stronger inhibitor of DHT and has been shown to also cause mild decreases in semen parameters that appear reversible after discontinuation. Let's take a look at a newer mouse study that was published in 2025. This study raised concerns about the role that finasteride and minoxidil may play in reproductive safety. When they tested finasteride and minoxidil in mice at 84 days, both drugs were linked to structural damage, including seminiferous tubule vacuolization, detached germ cells, and signs of cell degeneration. Finasteride demonstrated a more pronounced negative impact on the epididymis compared to minoxidil, specifically affecting sperm count and transit time. This study highlights potential reproductive risks of finasteride and minoxidil, but we must take these results with a grain of salt because this was performed in mice. And remember that our overall human clinical data has overall been positive when it comes to reproductive safety with finasteride and minoxidil, specifically in men. I think it's always good to remain skeptical when it comes to the use of any medication, whether it's one that we've known about and have used for decades, or a newer medication that may still be in clinical trials or just hit the market. But remember that anything worth taking to help improve our hair that actually works will also come with potential side effects. There's no way to get away from that completely. That's how medicine works. Anything strong enough to impact some change will of course come with the potential of untoward effects as well. As scary as finasteride sometimes sounds, and as much as I want to cure androgenetic alopecia for all men with hair transplant surgery alone, it's just not realistic. We need finasteride or dutasteride at this stage. Maybe in the future there'll be newer medications that will replace these, but at least at this point in time, this is the only thing that helps protect our hair and prevent further loss in a reliable manner. In over 7 years in private practice in my own clinic, I've never seen someone take finasteride, develop side effects,
stopped the medication and where those side effects did not go away. I've also never seen someone develop infertility from finasteride, and especially upon stopping the medication where they did not see normal fertility return. Instead, almost every week I hear patients telling me that I wish I started finasteride much sooner in my life so I could have protected my hair more so I wouldn't have to get more and more surgery. And again, if someone has lost most of their hair and let's say they are a Norwood 6 or 7 pattern, as long as they have some donor supply, you can always potentially consider doing a hair transplant, but the potential densities that you generate are going to be more limited compared to protecting the existing hair and building on that with well-executed surgery. Now let's talk about a major fear that comes up once there's actually an active pregnancy. Can finasteride in semen harm a pregnancy or cause birth defects? The FDA label specifically addresses the concept of exposure through semen and notes that measured semen levels were studied and that even the highest estimated exposure to a pregnant woman through semen is extremely low compared with levels associated with developmental effects in animal models. And Mother to Baby, which is a widely used teratology resource, states that the amount of finasteride found in semen is small and is not expected to be enough to cause a problem for the developing fetus. So if your main fear as a guy is, am I going to harm my baby by taking finasteride? Remember that exposure through semen is not considered a meaningful risk based on the available evidence. So here's how I frame it clinically. So if you're healthy with no known fertility issues and you're not actively trying to conceive, there's usually no strong medical reason to stop finasteride. Again, based on the semen data in healthy men. But if you're planning to actively start trying to conceive and you want to remove every possible variable, a conservative and very reasonable approach would be to pause finasteride for about 2 to 3 months before you start trying. Why that timing matters is because sperm production takes about 74 days. So stopping the medication for 1 to 2 weeks before trying is really not going to change the biology very much. You have to think in months, not in days. So after that 2 to 3 month window, you can begin trying to conceive. And once pregnancy is confirmed or that fertility window passes, you can resume finasteride in most cases. So a common follow-up question that I often get is that if I'm stopping finasteride for 2 to 3 months, will I start to lose my hair? In most cases, the answer is no, typically not in a very visible or permanent way. Remember that hair loss usually does not happen overnight. Finasteride works over longer time frames, and so does miniaturization of our hair. A short pause of 2 to 3 months is unlikely to register any noticeable cosmetic changes for the majority of men. Where I get more cautious is if a guy has more rapid, accelerated hair loss, or if they've tried stopping finasteride before and they know that they start to lose ground very quickly. In those cases, the decision may tilt to trying to minimize the amount of time the finasteride is paused for, or potentially not stopping it at all. Keep in mind that in most cases, one's hair is maintained for about 3 to 6 months after pausing finasteride, especially if you've been on it for years already. But not everyone is on oral finasteride. Some guys are using topical finasteride to reduce the systemic exposure to the medication. And a lot of them are getting it from places online like feelconfident.com. But that raises a reasonable question, which is, could there be partner exposure through skin-to-skin contact from wet product or residue on the scalp? The answer is that there is some theoretical risk, but there are no strong clinical studies that quantify partner absorption from scalp contact. From a practical standpoint, if pregnancy is confirmed, most couples will choose to transition the male partner from the topical finasteride to oral finasteride to reduce the risk of exposing the female partner to the finasteride. Or they become very strict about application hygiene to reduce the risk of any potential household exposure. And make sure to check out our newly repackaged award-winning hair care line and sign up for our newsletter for the latest in hair loss and plastic surgery information. In summary, what the studies show is that most men who are on finasteride at 1 milligram a day do not have any meaningful fertility changes. A smaller subset of men, those who are already dealing with some
fertility issues may experience some lower sperm counts that seem to improve with the stoppage of finasteride. Semen exposure of finasteride is not expected to pose a meaningful risk during pregnancy. And if you do pause finasteride during family planning, plan to do it on the order of months, not days or weeks, because of what we said earlier about how spermatogenesis works. If you found this video to be helpful, please give us a like. And if you have any further questions about this topic, please leave them in the comments below. Thank you so much.